Okay. Hi, everybody. My name is Sarah, if you haven't seen me before, and this presentation is on the Henrietta Lacks case in my paper. So some public health concepts that I'm going to be covering is vulnerability in marginalized populations. I think that within this book, this one goes really well with it, and we had that individual paper that we wrote a little bit about it. And I just think that Henrietta and her family were very vulnerable in this situation, in terms of a lot of harm. They were about like a Black community poor. So that's one public health concept that goes towards this paper. And then chronic disease prevention and health promotion. I think that when we look at what the doctors were doing for her cervical cancer, they weren't necessarily totally health promoting her. They kept telling her, you're fine, come back, and then realized that she did have cancer. So they kind of were misdiagnosing her at first. And then chronic disease prevention, there's ways that could have been prevented. But again, this case was obviously from back then, so they didn't have as much to go off of. Some key challenges for public health in these cases is informed consent. This is really in relation to her cells. The family was not ever given consent to be able to duplicate the cells, to sell these cells. Henrietta herself never really had any informed consent about what was going to happen with her cells. There's definitely some racism going on, especially with the doctor making her go into a different waiting room during her appointments. There's kind of that white privilege compared to her as an African American. There was definitely some flawed practice of the cells within researchers. So I saw this article, and it's one of my references, and it was talking about how there was flawed practice of those cells, and researchers should not have been able to just be giving these cells away. There's usually a protocol that you should be going towards. But again, when you have something like this from back then, it might be why. Definitely another key challenge towards it was this trauma towards the family. Through this all, there's a lot of trauma that happened to the Lax family. Even one of I can't remember if it was a kid or a sibling, ended up changing their name because when they were going back to the same hospital, they were afraid if they knew their last name was Lax, that they would be treating them just the same, which is kind of sad to hear, is that you don't realize what's you're doing is going to impact the whole family. The family kind of stayed in hiding. Towards the end of the book, they talked about how um, the one girl finally was able to talk about the situation, but again, she kept thinking, are you getting paid to do this for me? Are you going to be selling this information? Kind of stuff like that. So there's a little bit of, she took a step back and was kind of scared to talk to a reporter. And then another key challenge definitely was that privacy and confidentiality towards the family and towards Henrietta herself. There's no really confidentiality during her whole case. Usually you go into the doctor's office, they talk about confidentiality, you're always signing something. But for her, it was like everybody knew everything. Like her cells were given away. She didn't have any say in it. And then there was no really privacy towards the family in that sense because her cells were duplicating, cloning happened, all of these things where privacy and confidentiality and informed consent especially should have been the main three priorities in this case. Some recommendations that I found while reading some articles is definitely having strict rules about informed consent for biospecimen research. So if you're going to be doing this type of research, having consent forms that are signed so that you are able to go forth with it and not hurt a family again. Again, that kind of ties into the privacy part I was talking about earlier. So I'll talk about that more in the paper about how protecting people is your number one thing when you're working in healthcare. And this poor family and Henrietta were not protected at all. Welfare of the vulnerable. So they kind of talk about how her cells were getting cloned and duplicated in all this, but even for the last one, compensation for family, the family got nothing out of it. They didn't get the money, and they were marginalized. They were living in low socioeconomic status, very poor poverty that you see in the end that the whole town pretty much is gone by the end of the book. And it's just heartbreaking to see that this poor family went through all of this, and in the end, they still didn't get compensated for what they should have been compensated for in the first place and should have been receiving something, not even just fame and anything like that. That they didn't want that. They wanted to make sure that they could provide for their family after Henrietta um, passed. So in my paper, I'm kind of going to tie all that together and see how we can learn from this case, and we'll be able to see that she is something that we need to learn from, and to learn that in today's day and age there are ways to protect family. There's ways for informed consent. There's ways not to break down a family and give them all this trauma. And then these are my references that I will also be using in my paper.